I'd like to welcome everybody to the Carlisle Community Forum. This is the Council on Aging and Carlisle's monthly television show. My name is Tim Holt, and I will be serving as the moderator of today's discussion. We should go for about an hour, and hopefully this is an hour of that will be interesting, informative to you all. By the way, today is February 21st. And we apparently are on target today for the warmest day ever recorded in February in Massachusetts, which is amazing. We're supposed to get to 73 degrees today. So any of you who might be watching this having come back from Florida, we did have a couple of 70-degree days here in Massachusetts this winter. I'd like to introduce the people now that are at the table who will be talking with us today, and we'll start from your right. On the far right is Nancy Jazane, who is representing the Friends of the Council on Aging here today, and she'll have some things to say from the perspective of the Friends. Next to Nancy is someone we all know, Angela Smith, who's the COA Outreach and Program Manager. She's sort of the face of the COA to the town and all the people that we serve. Next to her is our fine director, David Klein. He's the director of the Council on Aging in Carlisle. And our special guest is next to David. We're very happy today to have Mary Crow here, who is an educational specialist for care dimensions. And Mary is an expert in the area of hospice, and we're going to have a discussion about hospice services that I think you're going to find very interesting and informative. So with that, I would like to introduce David Klein, and he's going to also welcome you and kick us off.
Thanks so much, Tim. Hi, everyone. I just wanted to take a minute before we get into our regular program and mention something that Angela and I had collaborated on for our newsletter, which will be mailed out at the end of the week?
Friday.
Right. So people should probably be seeing it in their mailboxes by early next week. But there's a story on the cover page and also on page 6 about local and state tax breaks. And it's on the first page of the newsletter.
That'll perk people up.
I'm sorry, yeah. Well, there's a tax credit in Massachusetts referred to as the circuit breaker, senior circuit breaker tax credit, and it's a really great tax credit that not everybody takes advantage of. Now, there are income eligibility criteria, which is explained in the newsletter, or if you have any questions, you could always call the office or talk to your tax advisor, of course. But we want to point out that this exists because too many people just are eligible for it, don't take advantage of it, and it could cut. I think the figure this year is $1,080 off your taxes. So it's worth looking into. And if it doesn't work out, it doesn't work out. But if you don't look into it, then you might be missing out.
I think there's a little general confusion this year with there being changes, but they're not effective this year, and people have been thinking about taxes in a different way.
That's true.
They've got to sort of go back and think about it the way we've always thought about it.
It's a good point, Tim. And in this case, it's a state credit, so it shouldn't be affected by the federal tax law. So there's no reason not to look at it from that perspective. And also, then on page 6, in the section that we call Outreach with Angela, where Angela covers a variety of topics from month to month in the newsletter, she enumerates the credits that we have here locally in Carlisle that the town offers for people, the credits and the other deductions and resources that we have available. And again, not everybody would qualify for them, but it really doesn't hurt to take a look and see. And so we would really encourage people to look at it, ask questions, talk to their tax advisor, and go from there.
All right. Okay, so we'll be back to David and Angela with a range of different programs later in this program. But first, we're going to have our discussion with our guest in the early part of the program today, because Mary has to leave a little bit earlier in the program. So we're really honored today to have Mary Crow with us. She's a licensed social worker. Okay, and she is also an advanced certified social worker in the area of hospice and palliative. Okay, But the reality is she's been doing hospice work for 33 years, which is a remarkable period of time. Hospice, I come to understand it as I prepared for this, hospice was really sort of started in 1948 in England. And it didn't make it to the United States as a concept until the early 70s. At that time, Mary was interested in this work, and even as a teenager was involved with work related to hospice and the aging. So we really have someone with us who has been involved with hospice the entire time that it's evolved within the United States, okay? And it's becoming, I think, an extraordinary service to people. I wasn't aware of this. There are currently 1.65 million people involved in some form of hospice care in the country. And right now, the numbers are, they move around a little bit, but approximately 44 to 45% of all deaths now involve some sort of hospice care. So it's a very important issue to understand, because there's a high likelihood that people that we know and love and are going to be involved with hospice in some way. So with that, she's also a resident of Ipswich, and she went to Springfield College and has an advanced degree from Boston College. So with that, I'm going to introduce Mary and have her kick it off with a little introduction about hospice and the organization that she works for.
Well, thank you very much, Tim. It's a pleasure to be on the show today. So I am the education specialist at Care Dimensions, and Care Dimensions is the largest not-for-profit, it's the largest hospice in the state of Massachusetts, actually. We're a not-for-profit hospice, and we are located, our main office is in Danvers. We also have another office that's in the Waltham area, and we also have actually two licensed inpatient facilities, one in Danvers, which was the first licensed inpatient facility in the state. And again, that's the Kaplan Family Hospice House. We also are opening a second licensed inpatient facility on the Lincoln-Waltham line. And that's going to be coming up in a couple of weeks. So we're really excited about that. But Care Dimensions actually provides a variety of services. We do hospice care. We also do palliative care and provide support services as well.
So we talked a little bit, and one of the things that jumped out of the literature to me that's important was, and just stayed with me, is people often have an association with hospice with death, and it seems to me from my reading of it, is that hospice is really not about dying. It's about life and about quality of life in a time that is arguably one of the most important parts of a person's life. Right?
Absolutely, I agree. It's, and again, when people hear the hospice word, they sometimes, again, even now, because of lack of education and all, and some misperceptions about it, it's that people have this connotation that it does surround death and dying. But you're absolutely right. If people ask me what hospice means, it definitely means it's about living, and it's about living life for whatever time you have left with as much quality and dignity as possible. And that's what hospice does. It really helps people, again, who have a life-limiting illness or an advanced illness, and it adds a great deal of quality. Like I said, there's a lot of misconceptions about it. Hospice is actually a philosophy of care. A lot of times people will think that hospice is actually a place, and it can be, like I just mentioned, in terms of the inpatient facilities, the licensed inpatient facilities that we have. But it's really a philosophy of care that can be provided anywhere that person calls home. So again, and there's a lot of focus for that person in terms of living life fully for whatever time they have left. And again, with as much care, they focus on comfort and care, and they focus on, again, there's so much to do in this time that we call dying, and it's a stage.
Just sort of describe for us, if a family, hopefully early on, and
Yes.
you touch on that,
Yes.
has had a discussion and they decide for hospice care in
Yeah.
a situation where it is appropriate.
Yeah.
Just describe for us what happens, what actually happens in that process.
Yeah, sure. And again, I want to go back to what you first mentioned in that sentence, which is what happens for people oftentimes is that this comes up in crisis time, when people are really in the last or the final days, when that's not the time to be having these conversations, although, again, hospice is available at those times, but really when people, hospice is part of the continuum of care, and this should be talked about long in advance in terms of what one's healthcare wishes are, and that should be discussed early on so that when the time does come that people are in need of hospice care, it's a smooth transition, and that patients and families don't have to be afraid of it, and that, again, that they can get the quality care that they need in advance. A lot of times, as we were talking about, people have this feeling that it's always too soon, but really the reality it's it's always too soon before it's too late. So a lot of times this ends up being crisis when it shouldn't be. Good quality hospice care, there's so much to do in this stage of life, so you want to get in there earlier. So when people, again, anybody can make a referral to hospice, anyone, but you do need a doctor's order. So again, if people are interested in this, I've had people self-refer. There's also other times when the healthcare workers will bring hospice care up with the patient and the family to discuss that, and to see if this is something that they would like to do in terms of bringing this benefit to them, at this stage. So, like I said, it can come about in a variety of ways, so it's important, though, that people understand this.
Now, in the process of choosing, I know that we talked about there's a resource that you can go to that has information about various hospices, and I'm sure the physician is important, but the actual process of choosing a provider.
Sure.
How do they go about that?
The National Hospice and Palliative Care Association, NHPCO, is certainly a great resource. It's also important to, and what I want to point out to people is sometimes people think that there's just one big hospice out there. There are actually many hospices, and there are clear distinctions. Although all hospices follow what's called Medicare conditions of participation, there are some real distinctions between hospices, so it's important that people do their homework and in terms of being good consumers and understanding that. Part of that, too, is talking with other people who have utilized hospice services and how that went for them, but also, again, understanding and asking the questions, because like I had mentioned earlier, with hospice care, some hospices have part-time medical directors where, again, we have 8 physicians and 11 nurse practitioners. We have, disease-specific programs. We have the inpatient facilities. We actually have complementary therapies, which other hospices, not all hospices have that, partly because it's not a reimbursable service. But we know that complementary therapies such as pet therapy, music therapy, creative arts, there's all kinds of things in that regard. Those things have been seen, scientifically proven to promote health and well-being for a person. That's important. So we provide those sort of things. So you got to do your homework and ask those questions.
Now, you said something earlier that stuck with me. It's like the goal is to have the person cared for in as close as possible to the place they would call home.
Sure.
Yeah.
Well, and hospice care can be provided anywhere that person calls home. So again, a lot of times, about 50% of the people that we care for are in their own private homes, although many people that we care for are in skilled nursing facilities, assisted livings. There are some hospice beds in hospitals, also in group homes, homeless shelters, prisons, you name it. Anywhere the person calls home, the inpatient hospice facilities, which I mentioned, anywhere the person calls home. Also, it can be fluid, too, and people can receive that, they can go from one location to another and still receive services as well.
Yeah, we're talking about the choosing, and often that has a connotation that there's a spectrum of good to bad, but from what I've read, and now they're collecting information, 2 things. That one, that over 90% of the families now that have experienced hospice, and there's a lot of them now, at 45% and at 1.6 million, are extremely positive.
Absolutely.
About the experience they've had with hospice. So, so don't be alarmed about, don't be paranoid about the choice. Okay, there are a lot of great choices. Okay, apparently from the results.
Right.
And the other thing that you told me, which is you can comment on, is it now seems proven that people in hospice might live a little bit longer
Absolutely,
than
yes.
people who aren't.
Yeah, so let me go to the first point that you made, and one is, again, oftentimes, again, even those people who have had a lack of understanding of what hospice is about, and when they finally did come on to service, what we often hear is that we wish we had done it sooner. It's not an uncommon comment that we hear. So there's a lot of positive feelings in terms of, and people feeling like it made all the difference in the world. This is, like I said, such a critical time of life. This is really important that this go well. And that's our mission, to make sure that that happens. So, again, it's important. I'm sorry, the second part of your question, you were talking about living longer. So in terms of that piece, there are studies that have shown, because a lot of times people think, again, because they wait so long to come on hospice, that it's for those last few moments of life, whether it be hours or days. Actually, the studies show that people who come on hospice services live longer. And basically, they live on an average of 60 to 90 days longer. And there were two main components for this. One is that pain and symptoms were well managed. When people's pain and symptoms are not well managed, that can actually hasten death. The other component was there's that extra TLC that you get, that extra support, which really enhances quality of life. So when the pain and symptoms are managed and you're getting that extra support, it not only enhances quantity, but it enhances the quality of life during that time as well.
So in that process, when you're managing the symptoms, there is a component of, if you will, social work and relationship with the individual, but there's also a medical element of that in terms of the ability to dispense pain or palliative measures. And how does that work? Are there two people? Or
No, it's actually a team approach. So again, and it's a great question. You had mentioned Dame Cicely Saunders, who's that founder of the modern hospice movement. Dame Cicely Saunders was actually a nurse turned social worker turned physician. She was her own little interdisciplinary team. She really kind of and she actually formulated the concept of total pain. And she looked at this. It's not just about the physical. So these are clinicians, even the social workers or medical social workers. It's about spirit, mind, and body. So physical pain is not the only kind of pain that people experience. The emotional and the spiritual can be as distressing, if not more sometimes. So we work as a team. There's an interdisciplinary team with the physicians, the nurses, the social workers, the chaplains, the volunteers, the hospice aides. It's just, and then again, so again, when you're tending to the whole person, that's critically important.
Now, I hate to bring this up, but this is the world we live in terms of paying for all this. Okay?
Yes, yep.
I understand it's a covered service and...
Absolutely, yes. Hospice is a covered service. Actually, again, it's covered under the Medicare A benefit. So again, hospice is a covered benefit. People aren't going to get a bill for hospice. So basically, it's covered. It can vary in terms of scope and coverage, in terms of the insurance, but Medicare being most comprehensive. So Medicare covers it, private insurances, standard Medicaid. And some hospices, again, and these are some of the distinctions, certainly for our hospice, if people lacked insurance or had inability to pay, they would not be turned away. We also provide free service as well. So it's important to understand those things. But, insurance companies based out of the state of Massachusetts are mandated to have a hospice benefit. You'd be hard-pressed nowadays to find an insurance that doesn't have some form of a hospice benefit.
And they talk about things, 290-day...
Oh, yes.
Which comes out to 6 months, but then that's also renewable for some
Yeah,
periods, right?
so those are called recertification periods. So what happens is that once somebody is determined to be appropriate for hospice, they get approved for 90 days. At the end of that 90-day period, if the medical team is looking, the physicians, if they're still meeting criteria, they get approved for a second 90-day period. After that 90-day period, they get, again, the same thing happens. They look, these are called recertification periods. If they're still meeting criteria, it's 60 days. So 2 90-day periods, then an unlimited number of 60-day periods. You mentioned the 6 months, because again, a lot of times when people are thinking this, and we think that, that doctors have, that they understand this necessarily too. Not all doctors are clear on this as well. How it's written under the Medicare conditions of participation is, would the physician, not just one but two, so the medical director of hospice and the person's primary care physician, who is still a critical part of the team, would they be surprised, given the person's diagnosis and the usual course of that illness, would they surprise if they didn't live beyond the 6-month period of time? That's really how it's written, because a lot of times, sometimes a physician will feel concerned about saying, geez, that person, I don't know if they have 6 months or less, and the person might die even a couple of weeks later. So there's no negative ramifications for the physicians.
So the notion, the business side of it is always going to want some specifications, right? So this 6-month thing is written in a way that hospice is available for people where a diagnosis is 6 months or less. However,
right.
That does not mean that you'll end hospice care
That's
at 6
correct.
months if you
Yes.
live, right?
If people can be on hospice for a year or so, a year or two, because again, as long as they're meeting criteria, yes, absolutely. So as long as they're meeting criteria, they can continue on. Everybody's journey is different. People decline at different rates. So again, as long as they're showing that there's decline in status and they're meeting criteria, they can continue on. It doesn't end after that 6-month period. It's interesting because people think that they're signing on to a benefit, they're kind of, people can opt to come off. I'll tell you, it doesn't often happen because, again, like I said, people generally say, we wish we had done it sooner. Another thing, too, is that we do have hospice graduates. So, there is a percentage of people that because they improve and they stabilize, they can come off service. There's no time that they have to wait in between. If they then show decline that qualifies them to coming back on, they can come back on service.
So as we keep coming back to the discussion and decision process of having good discussions related to what you want the quality of life to be near the end of your life.
Absolutely.
And having it early on.
Yeah.
And I think we also spoke that we're in a period of transition. I think we're getting much better information through many forms of media. Atul Gandhi and others are writing eloquently about the last years of life. But physicians are trained to save life.
Right.
They're not trained to manage death, right? And that's changing.
Yeah.
But it is a discussion that needs to be driven by family, the patient, and the medical care people and people who are experts in
absolutely, yeah.
Care, right?
We are making headway. I feel very strongly about it and very passionately that we are making headway. We still are a death-denying society, and that's the hard part, right? And again, we are making gains. And what's hard is that, again, there's still this notion of death being seen as a failure amongst healthcare professionals when, again, death is a part of life. And again, the failure, and Atul Gawande and Ira Byock, I don't know if you've ever read any of his work, they talk about it. The real failure is when, again, if somebody dies poorly, it doesn't die well, when it's not, this is, again, such a very personal stage of life, and it's so critical that we do this well. So I think, again, we have to educate people around this. Death is not the failure. It's when we don't provide the proper care at that stage. It's important that people understand their disease process, that they understand the treatment options, the benefits, the burdens, and the critical piece, and I think this is what hasn't been done in the past because of, kind of following a more paternalistic type of healthcare system. We never kind of focused on what is the individual's priorities, because we have to ascertain that. What are the priorities of that person, and how do we align the treatment approaches to their priorities? And I think there's more focus on that, and I think there's more awareness. It is hard for physicians because, again, the goal is, we have to treat at all costs. But when medical intervention is futile, there's still much more that we can do. But again, it might not be with more medical intervention. It might be, again, hospice care coming in and providing this good quality care and comfort and helping people to live fully whatever time they have left.
That's great. Again, I find it remarkable, that you've been involved with this process in the United States almost since the inception of hospice services in the United States.
Yeah, I know. I'd like to say I started at 6, but we know otherwise by the gray hair, right? So, but you know, and in my career, so again, like I had mentioned, I've done medical social work for the past 33 years, and I did volunteer work back in the late 70s when this first came up. But it's interesting. So I've worked in a variety of settings, but you know, and hospice has always been a part of that, right? When we're working with people with advanced illness, or you know, it's always been a part of that. And I've kind of watched this kind of go, and you know, opinions change and feelings. I feel like, again, we the more that we get the information out so that people understand, the word hospice, people shy away from it. It means hospitality.
Yeah.
It's not a negative word. It's the connotation we put to it. So how do we help people understand that when hospice is involved, we don't want people just to take to the bed and wait for a medical event to happen. That's not what it's about.
Well, one way that we help people understand is the type of job that you do. You tell me now that you're sort of out of the clinic and you work on education and you
Yes.
do this, something
Full
akin to
time.
this, 500 times a year?
That we do over 500 programs for professionals and communities every year.
Yeah.
And again, you know, so that people can really understand, there's, you know, education, it's such a critical piece to helping, again, to dispel these
So if you,
misconceptions.
I know you have to leave, and it's been such a pleasure to have you with us today.
Thank you.
If there's one thing that you would like to leave for our audience in terms of a message, what would that be?
Oh, thank you. Yes, it's been a pleasure to be on the show, and thank you for the invite. And, you know, what I'd love for the audience to understand is that, again, hospice care is this wonderful benefit that people are entitled to. And that, again, it's not about, when people hear the word hospice, they don't have to be afraid of that. Like I said, this is about when hospice comes in, they want you to help you to live fully for whatever time they have left. Those support services are so critical. So again, if I want people to be less afraid of the word and to have a greater understanding of what it's really about, because people are entitled to this benefit. And they deserve to have good quality end-of-life care. And like I said, it's, you know, dying is a part of living, and this is a stage of life. So that people don't feel isolated and alone, we don't want to put people in that situation. We need to have these conversations. The other piece is start the conversations earlier. Don't bring this in when somebody's actively dying, because then it looks like this is all that this is for. It's so much more than that. Start the conversations much earlier in life and make sure that hospice is a part of that continuum of care.
Well, I'm pretty sure that anyone watching this will be a little bit less afraid of
That's
hospice,
great.
given the information you've given us. Yeah.
The one thing I'd like to say to all the seniors, which I hear over and over, is they have a spouse or a loved one and they take them to the hospital and the doctor says, you have to do this.
Right.
And the answer is you don't have to.
That's right.
The answer is you need to find out what the choices are, what the ramifications for those choices are, and then make a decision. Because I see so many seniors go off into treatment that are painful and difficult only to have their loved one suffer and not live any longer. And they don't know they have that choice.
Absolutely.
So I really want seniors to hear you have the right to ask questions and find out what choices do you have, what treatments are available, what are the benefits and detriments for those treatments. And hospice and palliative care is a big choice. I think the thing that made me most happy about my job is one senior who husband was in assisted living, had dementia, then got another illness, and was about to put him in a higher level of service facility. And I said, why? And she said, what do you mean, why? That's what the doctor said. And I said, why are you doing that? Does he have any quality of life? And she said, oh. And she thought about it, and she discussed it with her family, and they decided to go to hospice instead. Mm-hmm. She came back after the husband passed and said, that was the best thing you could have ever said to me, because we made a choice that we didn't even know we had to make.
Yeah.
Well, I'm sure, at least in Carlisle, the seniors will do what Angela says to do.
Well, I don't think so. I don't think so, but it just, you know, I don't like to see people suffer.
Yeah.
And,
No,
and they're trying to do the right thing
Yeah.
for their spouse.
And you know, and I would echo that. I mean, I'm I'm sure Mary would also. But I do think the physicians are on this learning curve also. I do think there is change
Oh,
in the
definitely.
physician community
Absolutely,
to
yeah.
offering options and being, particularly personal physicians. I mean, specialists have their specialty, but the personal physicians, I think, are much more attuned to quality of life than they were 10 years ago.
I agree.
Absolutely.
All right. Well,
Yeah.
thank you very much.
Thank you
Mary.
very much for
Pleasure.
having me here. It's a pleasure,
And I know
Tim.
you have to get off to your
Thank
next of 500.
Thank you all very, very much.
Thank
Thanks,
All right,
Mary.
Thank you. Take care.
Nice meeting you.
Thank you. You too.
All right. Now we'll sort of switch gears a little bit and go to our the part of our program that's devoted to programs and issues that are put on by our Council on Aging or coordinated by our Council on Aging. And we'll start that because Nancy has to leave a little earlier too, with Nancy, who's going to talk about a few things from the perspective of the Friends of the Council on Aging.
Okay, thank you. First of all, I'd like to once again thank the Carlisle community for your outpouring of support during our fundraising this winter. We are still accepting donations to our PayPal account on our website or to Box 38 if you just didn't get a chance to get to give and you wanted to. What is this money for? Every year, the Friends give a grant to the Carlisle Council on Aging, and it's used for a variety of services and programs, including such things as fuel assistance and food assistance, and subsidizing exercise classes, and going for monthly breakfasts for seniors, and even contributing to some of the transportation operations. These are just a few of the things. In addition to our grant that we give, we also co-sponsor programs with the Friends of the Gleason Public Library, and these are cultural or historical programs or health programs. And coming up this month, in the month of March, is Jane Blair, who has her own company, Art Matters, and she's going to be doing 3 presentations. The first one is on March 7th, and she's going to be talking about women artists from the Renaissance to through the 19th century. On March 14th, she'll pick up where she left off and talk about women artists in the 20th century. And then finally, she'll take a different turn for the third program. She'll be talking about portraiture and how it's not just about the subject or the image in the portrait, but it tells something about the family, about the time, and about the culture. So that should be interesting, especially
She's
after.
great.
Yeah.
I mean, I love it. I always have the feeling that anyone along the spectrum of art expert to beginner will take something away from her presentation because she's lively and interesting and keeps it going. Right?
I think so too. And the
Okay.
portraiture will be especially interesting just in light of the very famous portraits right now that have come out on our previous president and his wife. So that will be interesting. So those are given offered at St. Irene's at 1:30 on those Wednesdays, the 7th, the 14th, and the 21st. And I encourage...
Register through the library.
Right, register through the library, and if there's a wait list, put your name on the wait list, because often people
Well, there shouldn't be wait lists because St. Irene's allows us to have over 100 people.
Oh, good, okay. So, then in the month of April, there'll be 2 health programs, which are of interest to many people. The first one on April 10th, it's a Tuesday at 1:30, but that's at the library. It will be on, Dr. Andrew Budson will be talking about the 7 steps to managing your memory, what works, what doesn't work, or what's normal, what's not normal, and what you can do about it.
I
And
can only remember the first 5.
I know.
You're doing better than most of us.
That was easy.
He's got quite the resume. He's the chief of cognitive and behavioral neurology at the Veterans Affairs Boston Healthcare
Yeah.
System.
Yeah.
And we got him because David saw
Oh,
him at the conference
Right.
for the Council on Aging.
right. Every year, the Mass Council on Aging has a fall conference, and he was doing a program there, so he had representatives who were talking about his book. He has a book called just what you said, I think, Nance, The 7 Steps to Managing Your Memory.
Right. Which will be available for sale that day.
Oh, good, good. And then the other program is offered by a woman, Dr. Ann Burnham, and she'll be talking about your eyes and how you take care of them as you age.
She's my eye doctor.
Yeah, exactly. And she is, in fact,
She's
from
mine, too.
Lexington.
She's great.
Yes.
She's
And
great.
she lives in Carlisle.
Perfect. Again, I encourage you to go to these programs. I also want to put in a plug for the people who do vet these speakers to make sure that they're good for our community, who work out the scheduling, the venue, and that's Angela Smith, Estelle Keast, and Martha Feeney Patton. So we thank them for that. And that's it.
Well, thank you very much. I would just, as you finish, reemphasize there's still time to give to the Friends of the Council on Aging. You know, I always think of the Council on Aging as one of the most productive organizations that we have in town, given the volume of programming and the number of people that they interact with versus the budget, which I believe is modest in terms of our budgeting. And what people decide to do is appropriate, so it's fine. But we get so much out of what I think is a modest budget. And from a leverage standpoint, adding the amount that comes from the Friends leverages that so much and allows us to do so many more things, which I think it's a great thing. And don't change your habits because of the tax laws. Change your habits because this is a great place to put some money.
Exactly.
Okay. Thank you very much.
Thank you very
And I know
much.
you have to leave also, so feel free.
Thank you,
Thank
Nancy,
you.
for
Thanks,
everything.
Nance.
With that, we're going to go back to the tag team of David and Angela here, and I'm going to let David start it off talking about what's going on.
Thanks. The fun stuff, right? The stuff that the Friends group and our state grant and the community chest help us fund. But before we jump into it, I wanted to go back to the tax break thing for just a second, because one of the things that Angela had put into her piece on page 6 of the newsletter caught my eye just now, and that's that to apply for the local exemptions, there is a deadline of March 30th. And so people might assume that the federal tax filing deadline of April 15th is the deadline for everything. And that's true for the state tax exemptions and whatever federal tax exemptions there are. But for the local tax exemptions, you actually have to apply to the Board of Assessors for several of them. So just keep that in mind, March 30th. I mean, there's still plenty of time. Today is what, February 21st? So a month till the end of spring. I mean, the beginning of spring, which is great. But keep the March 30th deadline in mind. And also...
Can I just say one thing about taxes? 'Cause
Sure.
I was just doing this. I was working with my own mother-in-law, and when you make a decision to go into an assisted living, there's often a significant fee on the front end.
Yep.
A significant portion of that fee can be itemized as medical expenses. Okay, so just whatever, these are not accurate numbers for anyone, but if you pay $100,000 to get into this and sort of get your apartment, a good percentage of that, okay, not all of it, but a percentage of it is future medical expenses. So it's a one-time, fairly large item on itemized deductions.
Sure.
So when not that you would make a decision of timing on the move to a home on the basis of that, you can make a decision on certain other things related to using that full deduction, if you know
Right.
what I'm talking about.
Yeah, yeah.
Okay.
So the timing is important.
I wasn't
and-
aware of that.
wasn't either.
That's a good point. I mean, people, even with the new tax laws, people have been mentioning things to us. One of the things that I think we could possibly spend a whole program on, that one of our Friends board members, John Mine, who's the treasurer of the Friends group, had mentioned to us, was something called a QCD, QD, hold it, qualified distribution, QCD, qualified. Anyway, sorry, I'm blanking on the acronym. But if people are taking required minimum distributions, and this is from people that have retirement plans, whether it's an IRA or a 401k, and you reach age 70 and a half, people who have gone over age 70 and a half that has retirement accounts know about this because their tax accountants or their tax advisors tell them, hey, you have to start taking money out of your account because the government wants to tax a portion of that money. And so people who have to take these required distributions, there's an option that they can do to make that distribution qualified, whereupon they can either do part of it or the whole distribution itself. If they want to designate that towards a charity, a qualified charity, a 501c3 organization like the Friends Group or other worthy charities, then that money does not become taxable to them. Which is a wonderful option, and is available. It's a break in terms of taxability on that distribution, both at the federal and at the state level, because Massachusetts has adopted the federal standard. So
tells me we're going to have a lot of tax discussions over this.
Probably so. And on that point, my last point on taxes, before we jump into our programs, is that there is a program to help you with your tax returns through the AARP Foundation. And we don't have volunteers to do that here in Carlisle, but we're lucky that we have a collaboration with our fellow COAs in Chelmsford and Bedford, and they have volunteers that will help people with their taxes. And that actually is mentioned on page 7 of our newsletter, and it gives the Bedford and Chelmsford telephone numbers to call.
Right.
And if they want to do it, they should call soon and get an appointment because the appointments fill up fast.
That was going to be my next point.
Sorry.
They really, there's an excellent point. They really fill up fast because they only have so many people that are trained that have the time slots to do these. And usually it's only 1 or 2 days a week that they do it. So anyway, let's jump into our program.
16 minutes
Okay.
here.
Yeah,
so
let's see what we can do.
Let's whip ourselves through
Yeah.
these programs.
Okay. Well, a couple things coming up, real quick. We have some restaurant reviews and some trips that are coming up in April and March, and then a few in May too. But to go to the April and March and April ones, Joanne Willens has a restaurant review, which is a gathering of people that go to a local restaurant for lunch. And the first one upcoming is going to be on March 5th, and that's going to be at a place called Aviva Cucina in Westford. So that is going to be on Monday, March 5th, and if you are interested in going and joining them, please contact Joanne Willens directly at 978-371-8023. Please register by March 1st. Joanne has a second restaurant review for April 9th at a place called The Establishment in North Chelmsford. And similarly, you would call if you wish to join them for the April 9th, you would call Joanne at 978-371-8023. So the 2 restaurant reviews are to Aviva Cucina for Monday, March 5th, and The Establishment for Monday, April 9th. And we have a trip that Angela and Debbie worked on with Joanne to the Isabella Stewart Gardner Museum in April, and that's going to be a wonderful trip. That is on Wednesday, April 25th again, but there is it's a first come first served basis type of trip where we have 12 seats on our van. So we want people to know about it and make a conscious decision. The weather should be good by that time of the year.
We hope so.
Yeah, we hope so. There's a second one.
Nothing like walking into that Central Plaza in springtime.
I've only been there once, and I keep saying I want to go back. I was there in the fall, and I hear for every season they have a different display. I know this is a May event, and it's a little bit further out, but we are doing also a Boston Public Library tour, and the cost for that is going to be paid for through us, except for the van fee, right?
I think so.
Yeah, I think we're paying for it. Again, there's only 12 seats, but it's going to be a guided tour that the COA through the Friends Group is paying for. So that is going to be on Tuesday, May 15th. And I'm going to turn the rest over at the moment to Angela because we have a lot of other things to cover.
Okay, so then we're going to feed people.
Yeah.
And we have 2 Chelmsford Crossing lunches. One's on March 1st, and it's at St. Irene's, and you will be our guest, and you're going to talk about Carlisle and its history. And because it's close to St. Patrick's Day, we're going to have corned beef and cabbage. And Chelmsford Crossing does the cooking for this, and I had their corned beef and cabbage last year, and it was incredible. So if you're hearing this and you like corned beef and cabbage, sign up. Then on April 5th, they will have the next Chelmsford Crossing, and we're going to have, which I think is astronomical that they're going to give us this, lobster Newburgh.
No.
And we're going to have Lenny Del Siemens, who's a folktale storyteller, and she is going to perform thanks to the Cultural Council. So we'd like to thank them for funding that. And we have our coffees in March and April.
Where is that dinner? Where's that lunch?
That one is at FRS.
Okay.
So on April 5th at FRS, just call us and make a reservations, and we are taking reservations for all of these now. And then we'll have our regular coffee once a month and our social hour where we go to Benfield and sit around and have some refreshments and chat and meet people. The COA luncheons for March and April. The one for March, here it is, sorry, is at FRS, and we're going to have pizza, and we're going to have the New Orleans Jazz Band, and Santo Palara, who's one of our seniors in his 90s, is performing, and they're a wonderful jazz band. So if you like jazz, come and join us for that. And the COA lunch for April, which will also be at FRS, and the food will come from Chelmsford Crossing, and it's beef stew. And we're going to have birding by Seasons by Alan Ankers, who's also a Carlisle resident. So Alan does a great job, and he's working on the slides, and he's really dedicated.
Really good.
So
He's
that
really
should be
interesting guy.
a really good presentation. And we have the women's breakfast. We don't often have a women's breakfast. We have a men's breakfast monthly, but a women's breakfast only a couple of times a year. So we are thrilled that Sally Hayen and Ann James are coordinating a potluck women's breakfast on March 27th.
The men's breakfast.
Pardon?
I'm sure cleanup will be easier for the women's breakfast.
No, actually, because my husband does the men's breakfast, and he's like managed to figure out the big dishwasher at Village Court. So he's got it down to a science.
Good.
So, and we hope people come and join us for the men's breakfast, which is on March 8th and April 12th. And then we're going to the high school, which you were on the building committee for, and that's going to be on March 17th for their student dinner for the seniors. So people should sign up, and it's at noon, but we will have a van going from here. And the Carlisle Public School is doing their annual tea for us. So we're going to go and have refreshments with the middle school and play games, and they usually go to a lot of effort to entertain the seniors. So we're looking forward to that.
And we should say that the St. Patrick's Day lunch is sponsored by the COA here for Carlisle COA residents, senior residents, and we've paid for it at various times through either our Friends Grant or through the Community Chest Grant.
And then we have a couple of special events coming. One is the Middle School Folk Dance Club. The new music teacher did some of the Christmas program with dance. So the seniors loved it, the kids loved it, so they're doing a special program, and the teacher's even baking for the seniors. So that's going to be on April 23rd at the school. And we're going to start a meditation group, because people mentioned when we had Dr. Giannetti that they liked the idea of that. So Tom Dunkers is going to teach people how to meditate, and that's going to be at Benfield. We have one of our own seniors, Janet Altabello, who actually lives in Chelmsford but has become a Carlisle volunteer, and she's going to teach people how to make cards. So before Easter or
Like he's like greeting cards.
gift. Yes. And so we're going to do that on March 20th. And then we were going to do trivia on Monday. We've found that we didn't get much response. So we're looking at moving trivia potentially to Saturday and opening it up to a wider audience of people who work in families. So we're going to get the word out about that. And we always have our outside walking group with Jane Anderson and Helen Young on Thursday morning at 9:30. And my guess with this weather is they'll be doing it shortly.
It's been a long time. They've done that for
Yes, years.
Yeah.
They go for about an hour and a half to all the different trails.
that's great.
On the musical side, we have an event in March for the Carlisle Chamber Orchestra, which is on a Friday evening, Friday, March 9th at 8 p.m. at Congregational Church, and it's an all Mozart program for those that wish to attend.
And David, maybe you want to talk about a little bit about some of the exercise classes.
I would be delighted to, Angela. So as many of you know, and this really is one of our most popularly attended type of events, we do several different types of exercise programs on different days of the week. On Mondays, we have an intergenerational tap class at 1:30. That is at FRS. Because we love FRS's great wooden floor in Union Hall. On Tuesdays we have two classes: a Zumba Gold class, which is coordinated. That's the one that's coordinated through the Recreation Department.
No, that's yoga.
That's yoga. Okay, sorry, yoga and Zumba. I just confused them momentarily. But we also, that's at 10:45 in the morning. It's taught by Katrina Rotundi, who teaches, who's wonderful. She teaches quite a few of our exercise programs. And then in the afternoon on Tuesdays, we have a Tai Chi program or class that's taught by Linda Sango, and that's at 12:30. So either way, you can do your Zumba Gold or your Tai Chi on Tuesdays. And the Tai Chi class is at St. Irene,
Yes.
I believe, yes.
Yeah. And Tai Chi and fitness, right now we need some more students because we have a minimum number for every class. And because of a number of things that have happened, we've lost a few. So if you're out there and you're hearing this, both of them are great exercise programs. Tai Chi, if you're looking for getting balance in your life and serenity and good health, and the fitness is really excellent for any kind of.
There's no fees or anything. Are there fees?
There is a fee for the majority of classes, other than summer. It's $40 for 3 months.
3 months.
And if
$40.
you're not able to
Beats the
pay
gym.
that, come and talk to David or I, and if you live in Carlisle, we'll look at doing a partial scholarship. But for that and fitness, which can be done sitting down, so if you have limitations about your ability to move, that's an excellent class that anybody can do. So both Tai Chi and fitness, we need some extra students.
And in terms of the way, all exercise is great in terms of how it makes you feel, but some programs, in particular, for me, I've done Tai Chi before, and in more recent years, yoga. I really just love the way I feel after I come out of those classes. Speaking of yoga, and speaking of our collaboration with the Recreation Department, we have a yoga class that's held on Wednesday mornings at Benfield Farms, and people can register through the Recreation Department. It's the information for their phone numbers in our newsletter. And Katrina teaches that one too. No, she teaches line dancing. It's another instructor that teaches the yoga class. I don't know her name, but I understand she's really excellent. On Thursdays, we have the fitness class that Angela was mentioning at 9:45 right here in the Clark Room at Town Hall, and a cardio boost class right after that, an hour after that, if you want to do double dipping on your exercise. That's also right here in the Clark Room. And on Fridays, we have a class which is kind of unique, or maybe not totally unique in Massachusetts, but it's one of the more interesting programs. It's called SAMA, Senior Approach to Maintaining Agility. An instructor, Sensei Sarah, comes from Boston, and looks like we have 5 minutes left. Sensei Sarah comes to Boston. She's the daughter of Sensei Tony, who was the original instructor for this class. Angela, you partake in it, and I believe you
love it.
You love that class. So we're like the hair club for men. We not only talk about it, we participate. We have the walking club, which is at the Carlisle School gym for this time of the year when it can still be cold, to call David Flannery to participate after 4 p.m. before the 5 a.m. that you want to walk. And another, speaking of music, there's a rehearsal for the Concord Players senior production of Hunchback of Notre Dame, which is going to be just $5 at the door. That is Thursday, April 26th at 8 p.m. And do you have to register for that ahead of time?
Nope, just show up.
Just show up, pay your $5, and you can see. And I confess, I've never seen a Concord Players production, but I understand they do a great job.
They really do a great job. It's amazing the quality of local artists that's available.
Right, that's right. Segueing back to the health for the moment, we have a podiatry clinic which is going to be going on at Benfield Farms on Monday, March 5th and Tuesday, March 6th. The podiatry clinic, which is subsidized by the Friends Group, is so popular that the podiatrist has actually asked us to split it into 2 days because it's just, it's a long day seeing 40-some people.
40 people usually go.
Yeah.
Great.
So let us know about that. The cost, we should mention, has gone up. The podiatrist had been holding the line for numerous years at $30, and it has gone up to $35. However, $10 of it is paid through the Friends Group, so the cost to each of the participants is only $25. But that is an increase from 20.
Right.
Just we did want to mention a couple other things going on here at Town Hall. We have a Haircuts to Go, which is a by appointment opportunity to get your haircut for a fee of $10.50.
Where else can you
do
go?
those, don't you?
I do. I do. I actually need my eyebrows cut too.
I'm sure they do that.
Yeah. And we also have, we should have mentioned, we also have blood pressure clinics, but these are usually held not as standalone events, but along with our other events like the lunches at FRS and St. Irene's and breakfasts. And we're lucky to have various sponsors that cover these blood pressure clinics, although I think we have a gap that we're looking to fill more longer term.
I filled it.
Oh, you did?
Yep.
I can't, every time there's an issue, there's a solution. Is there any of these other programs that you wanted to hit?
I just want to quickly mention, excuse me, that we have knitting. There's 2 knitting groups, one that knits for the homeless in Boston with FRS, and then there's the Gleason Knitters who knit out of the library, and there's a mental health support group that Mira Briere, who has been on our show, is doing for us, and she'll be doing it March, April, May, and June, and those dates are on our newsletter and also on the library website. So, and we're going to be doing senior Charlie cards for people that don't want to go into Boston. If you're over 65 and you want to get a Charlie card, just call us. You don't have to be from Carlisle. You just have to be over 65.
We're down to about a minute. Our next program, do we know the guest?
Yes, we're going to be having Derek Logan from New England Medical Equipment, and he's going to show us how there is a right and a wrong wheelchair for people.
Okay, so that's the next show in March.
In March.
A lot going on in March, and
Yes.
I want to thank everybody for tuning in to see the Carlisle Community Forum and be aware of all the programs and interesting things that are going on that are sponsored by the Council on Aging. And from the standpoint of someone who watches from afar, thank you both for all the great work you do and the people do in the Council on Aging. And with
Thank
that,
you, Tim.
Thanks, Tim.
we'll sign off.